Welcome to Aging Insight with your host, John Ross and Lisa Schollmeyer. This program is made possible by
Welcome to Aging Insight, everybody. I'm your host, John Ross, here with my co-host and law partner, Lisa Schollmeyer, and she and I are elder law attorneys. We practice right here in the Arklatex, and we bring you this program every week to address the kind of issues that relate to getting older. We want to address your health, housing, financial, and legal needs, because we know that with a little bit of information, you can navigate through the aging process on your own terms. That you won't have to worry about things like becoming a burden on your friends and family and spending your last dollar paying for yourself, because you will have been educated by watching this program. That's what it's all about. You know, and of course, one of the big key pieces to your health, housing, financial, and legal, one that almost brings it all together, is your health insurance, especially as you start approaching retirement age. And of course, what are we talking about?
We're going to talk about some Medicare.
Medicare.
That's right.
Now, you know, in our practice, we oftentimes we see kind of two groups of people. We have the people who are, our senior adults, people who are in that aging process. They're in their 70s, 80s, 90s, hundreds. We even occasionally might have somebody over 110. But those folks have already, they've already enrolled for Medicare. They're getting their Medicare benefits. They pay for a little supplemental insurance and things like that. But then there's the other group, and the other group are those folks under the age of 65 who are approaching this time frame and just really don't get all of this business.
Right. You know, it's really a little overwhelming. And, you know, one of my favorite little sayings is that, you know, life doesn't get simpler as you get older. In many ways, it gets more complicated. And frankly, I don't think that that's any more true than when we're talking about signing up for Medicare, choosing the right Medicare plan, choosing the right supplemental Medicare plan. That can all be, there's just so many moving parts to all of that. So as you near retirement age, and I'm talking to those 60 to 64 out there, there's just a lot of questions about Medicare particularly. I mean, you know, these days, our retirees that are retiring now, the full retirement age for Social Security pension portion is 66, but yet Medicare, the health insurance portion, is typically available at 65. And you know, so John, not only is it available at 65, you know,
right, but you know, if you worked during your lifetime and you've got at least 40 credits of work, when you turn 65, you're going to be eligible for Medicare. And of course, with Medicare, you've got Part A, which is your hospital benefit. You've got Part B, which is your doctor benefit. And then you've got Part D, which is your prescription drug benefit. Now, of course, in addition to that, there's also an E, F, G, H, I think. We're not going to get into all of that. Those are your different supplemental policies. But you know, even if you never worked in your whole lifetime, you'll still get B and D, which is your doctor's benefit and your prescription drug benefit. You might have to pay a little bit for the prescription drug benefit, but you'll get but you only get A free if you've had 40 work credits, and you get that when you turn age 65, or if you've been declared disabled by the Social Security Administration for 2 years. So if you were, say, 35 and were declared disabled by the Social Security Administration, well then 2 years later at 37, you would become eligible for Medicare. But for the vast majority of people, it's going to happen at 65.
Right, and so those work credits that you need, those work credits basically amount to 10 years of work where you were paying, where you were having Social Security and Medicare taxes deducted out of your paycheck. So 40 work credits, it takes 40 quarters, 10 years of work to achieve. So most people do have those enough work credits to get Part A and Part B Medicare. We just have a few. If you don't have enough work credits, you might qualify for those benefits, the Part A benefits, based on your spouse's work credits, even if that spouse is deceased or you were divorced from that spouse. So, definitely important benefit to check out. So John, one of the things that's confusing to people is that now full retirement age for Social Security is 66, but yet Medicare still kicks in at age 65.
That's right. And although they're both, you go to the Social Security office for both of them. They're certainly two different things. One, like you said, one deals with that Social Security benefit, but you do not actually have to be receiving a Social Security benefit in order to be eligible for Medicare. All you've got to do is be 65. And of course, even if you're still working, and even if you have other insurance, oftentimes that other insurance that you have through your employment, you might like that insurance, you might be perfectly happy keeping that, but a lot of times in the policy, they will actually require you to become Medicare eligible at 65 and go get that Medicare so that they don't have to keep paying for you. Or at least so that your work insurance can become your supplemental, which costs the company less. So that kind of leads us up to the next issue, which is, when exactly do you need to start looking at this issue, and who do you talk to, and where, and when? But of course, to get the answer to that, you're going to have to stick around past this break. So stick around, we'll be right back.
All our moments should be cherished. SEMA Hospice provides comfort care when you need it most with compassion, dignity, and respect. Along with Jordan Health Services, SEMA Hospice provides compassionate continuity of care. SEMA Hospice, comfort and care when it matters most.
The Oaks Independent are apartments for seniors who love secure, peace of mind, and consistency in their lives. Included in the price are cable, utilities, meals, weekly housekeeping, daily monitoring, and a medical alert device. All apartments wheelchair accessible, freestanding homes in a great part of town. Live in style, comfort, and accessibility. Live independent. Find us online or call today to schedule a tour. The Oaks Independent.
Hi there, I'm Larry Sims. It's been my privilege for the past several years to be a volunteer board member of Hospice of Texarkana, and there I'm able to represent community members like you. We continually customize our end-of-life care to better meet the needs of our community. As an example, our medical director and nurse practitioner still make visits to homes and facilities. Call today to learn more about the help we can give your family. Hospice of Texarkana, the nonprofit hospice established in 1985 for the community, by the community.
As things get older, they require more care. This car and I have seen a lot of miles together, but because I take care of her, she runs just like she did in 1955. That's why I chose the Wadley Senior Clinic, with an individualized care plan designed just for me and a convenient location off Jefferson Avenue. They have everything to keep me running like new. It's not about the miles, it's about the journey. Let the Wadley Senior Clinic keep you happy, healthy, and cruising down the road of life.
From our first moments to our final days, life's journey should be remembered free of burden and worry. Families should be cherished. SEMA Hospice provides comfort care, dignity, and respect. Learn more about SEMA Hospice at SEMAHospice.com. SEMA Hospice, comfort and care when it matters most.
Welcome back to Aging Insight. And today's topic is something that I guarantee you is on the mind of anyone age 60 or older. And that topic has to do with Medicare. And today we're talking about that initial sign up for Medicare, and that you can sign up at age 65. And in fact, in most cases, you will be compelled to sign up for Medicare at age 65, even if you are actively still employed and still covered by your employer's health insurance plan. You know, in today's day and age, most employer provided plans have special clauses that say they do not cover employees age 65 or older as a primary insurance, but they will only fulfill a secondary insurance role for those employees that are 65 and older. And basically, that forces that employee off the employer's insurance as their primary coverage, even if they like the coverage, and pushes that employee onto Medicare as their primary insurance. Right. So,
yeah, and of course that's just a cost-saving measure for those companies, and there's really not much you can do about it. If that's what they have, that's what they have, and so you're going to be going on Medicare when you turn 65. But that kind of brings up the next question. Well, whenever do you go the day you turn 65, or you go on your birthday? What about this whole open enrollment period? Well, I've always kind of found it funny. My father and I share the same name, and we live in the same town, and so, around October 15th is the, quote, open enrollment period. And this time frame, starting with October 15th, is the time where people who are already on Medicare and have a supplemental insurance policy can decide whether or not they'd like to switch to a Medicare Advantage plan instead of having traditional Medicare, or maybe they want to switch supplemental policies, and they can do all of this during from October 15th until for about a month or so. And I get a flood of mail in my mailbox during this period from all of these different insurance companies telling me about all of this. But of course, they mean to send it to my dad. It's just that we have the same name and we live in the same town. But so you might be thinking, well, okay, if I'm going to turn 65, if I turn 65, say in January, do I just go ahead and wait until that open enrollment period? Is that when I go and enroll for Medicare? Well, it's not.
Yeah, no. Actually, you have a personal or an individual enrollment period that's just for you. And the way Medicare is set up, when you turn 65, you actually have about a window of about 7 months, with 4 months being before you turn 65 and the remaining 3 months for after you turn 65. But you can sign up for Medicare anytime during that 7-month window around your 65th birthday. So you don't have to go on your birthday to the Social Security office or jump online. You can actually go before your birthday and get signed up. And some people don't think about it because they've got their employer provided coverage, and maybe if they haven't watched this episode of Aging Insight, they think that their employer coverage is going to continue, and then they find out differently 90 days after they turn 65. And the problem we have then is that you have your 7-month window to apply for Medicare around your 65th birthday. But if you miss the window because you thought you had coverage, or you didn't really feel 65, so you didn't want to go sign up for Medicare. But if you miss that window, then you are potentially out of insurance until the enrollment period for new Medicare, the general enrollment period, begins on January 1st after your 65th birthday. So, and if you get enrolled during that January, February timeframe, your actual insurance with Medicare doesn't start until July 1st. So put on your calendar those 7 months around your 65th birthday. That is the time to sign up for Medicare.
That's right, and like anything else, sooner rather than later, because you are going to get confronted with a lot of different options about traditional Medicare with supplemental insurance, Medicare Advantage plans, and within the Medicare Advantage plans, the different types of Medicare Advantage plans. So it would be a good idea to be armed with knowledge before you go in so that you have an idea of what to expect as far as what type of insurance is going to work for you. If you're still working, how is your employment related insurance going to come in? But you definitely do want to get it within this window if that's going to be appropriate for you, because like you said, if you miss it, it could be 6 months or a year where you have no insurance because you weren't able to get in on the Medicare, but at the same time your employer sponsored insurance won't pay for you because of that clause in that policy.
Yeah, now that's really a shocker for a lot of people, particularly in our area, you know, because we do have a lot of manufacturing jobs, and you know, I haven't looked at every union contract or every plant's contract, but you know, many of them have moved to, you know, the insurance coverage just till age 65. So got to be on your toes.
That's right. And of course, all of this also applies to people who have been declared disabled. And so if you were declared disabled 2 years from the date you were declared disabled, is this going to be the same time frame? And so if you were declared disabled in, you know, June of 2014, well then, you know, your open enrollment period will be the 7 months around that same date 2 years later. So
Right.
2016.
So yeah, that June 2016.
Yeah, the
a
4
few
months
before
before and
four
the 3 months
after.
after. That's right.
Yeah.
Well, we're going to take one more break, and we'll when we come back, we're going to keep talking about some of these Medicare issues and what you need to know. So stick around. We'll be right back.
With my dad, it was in a hospital setting, and in his situation, he fell into renal failure. He also helped us make the decision to be on hospice. I have to admit, it took a huge weight off our shoulders for him to be willing. That offered us a lot of comfort, along with the hospice company itself, but it gave us closure, and it helped us through the entire process.
SEMA Hospice, comfort and care when it matters most.
As things get older, they require more care. This car and I have seen a lot of miles together, but because I take care of her, she runs just like she did in 1955. That's why I chose the Wadley Senior Clinic, with an individualized care plan designed just for me and a convenient location off Jefferson Avenue. They have everything to keep me running like new. It's not about the miles, it's about the journey. Let the Wadley Senior Clinic keep you happy, healthy, and cruising down the road of life.
The Oaks Independent are apartments for seniors who love secure peace of mind and consistency in their lives. Included in the price are cable, utilities, meals, weekly housekeeping, daily monitoring, and a medical alert device. All apartments wheelchair accessible, freestanding homes in a great part of town. Live in style, comfort, and accessibility. Live independent. Find us online or call today to schedule a tour. The Oaks Independent.
Welcome back to Aging Insight, everybody. We're talking today about Medicare and issues related to enrolling with Medicare, and of course so far we've talked about when you're going to do it, and that of course is when you turn 65, maybe a little before, a little after, but right there around your birth date when you turn 65, or if you've been declared disabled for at least 2 years. So that's when, and of course what you're signing up for, which is your Medicare A and B and possibly D, depending on what other prescription drug coverage you might have through, say, an employer-sponsored policy. But of course, we kind of touched on this initially, Lisa, but if I'm going to sign up for Medicare, I just call Medicare, right?
Well, you can, and of course these days, these days you can actually sign up for Medicare online. If you go to SSA, stands for the Social Security Administration, but if you go to ssa.gov on the internet, you can actually sign up for Medicare on the internet, so that's one way. You can call the Social Security Administration and sign up over the phone, that's another way. And of course, you can walk into your local Social Security office and sign up in person. And, for many people, signing up online or by telephone, whatever's convenient might be just fine. If you've got your work credits in and you have sufficient work credits that you have earned the Part A coverage where you don't have to pay any premiums for it, then probably signing up online or by telephone is fine. However, if you do not have enough work credits, you definitely need to go to the Social Security office and actually sign up for Medicare in person. You might be relying on, a previous husband or deceased spouse work credits to get to your Part A benefit, or if you don't have enough work credits and you're actually going to be paying a small premium for those benefits to start, well, then you want to go to the Social Security office in person. And of course, if you're not an American citizen and you are a naturalized foreign person here, then you need to also sign up at the Social Security office.
Yeah. So yeah, it's at the Social Security office, which seems a little strange. It's not Medicare, but just because the way it works, you're going to go do this all at Social Security. Now, the other thing is with Social Security. Or with Medicare, in the Part A and the Part B, for the vast majority of it, this stuff is going to cover. It's going to cover about 80% of hospital stays and doctor's visits and things like that. And there's some things that are covered 100%, and some things that aren't. But for that other 20% that's not covered, that's where you're going to want to start looking around at other supplemental type policies. And of course, if you're still working, as we talked about earlier, your work insurance will probably become your supplemental. If you're retired military, then your TRICARE, for example, will become your supplemental insurance. But for everybody else, you're going to have to go and sign up for supplemental insurance if you want it. And of course, that's going to cost, and depending on what insurance company you choose and where you go and who you use, the premiums are going to be different, the policies are going to be different, and so you want to investigate that quite a bit. Now, notice this is not where you would go, say, on the healthcare exchanges.
Right. This is not Obamacare.
This is
type
not
plans.
Obamacare, and so you cannot go to the healthcare exchanges to get these supplemental policies. These you're going to have to go talk to insurance agents who are in the business of selling these. And one thing you may find out is that you cannot afford them, especially if you're one of these folks like Lisa was talking about who doesn't have a lot of work credits. You may get no Social Security, you may get very little Social Security. You may be working, but you may have very little in earned income depending on your circumstances. And so the other thing is you may want to look at what other assistance is out there. So, for example, if you were already receiving Medicaid benefits because of low income or because of disabilities, and you become Medicare eligible, well, one, you're still going to get automatically enrolled in Medicare. Your Medicaid then will start kicking in to cover your supplemental insurance costs. But there may be specific things that you need to do to make that happen. And so you'll want to definitely check in on that sort of thing. If you're not on Medicaid when you get qualified for Medicare, but you still think maybe because your income is very low, you might qualify for some financial assistance, you can look at these other programs that can help supplement. There's a lot of different programs out there, and they all have these funny names like the QMB, which stands for Qualified Medicare Beneficiary, or SLMB, and there's all these different ones, which I can't even remember what it stands for. That's right. But there's all of these, and these are Medicaid programs that are available to Medicare beneficiaries to help cover some part of the cost of either the Medicare premiums itself, the supplemental insurance, the prescription drug costs, and I've had people in the office who have been paying for a supplemental insurance for years, not realizing that this whole time they probably qualified to have the state pick up that cost for them. And of course, you know, when your total household income is $900 a month, dropping a third of that on a supplemental insurance policy is a big deal.
Right.
So you definitely want to explore all of those different options. And of course, when it comes to that, that's not something you would go to the Social Security Administration for. That's one of those things that you would want to go see the Area Agency on Aging.
Ooh, give a plug for them. They have a benefits coordinator at the Area Agency on Aging, and we're fortunate in our community that our Texas residents, there's an office on Elizabeth Street, and then our Arkansas residents,
They have an office over on Jefferson, and although they're based out of Magnolia for our region, but they'll be more than happy to visit with you here locally about those sort of things. So you definitely want to explore what other options are available to help cover these costs. And again, the sooner you get on this, the better.
Yeah.
Because you don't want to find out too late that you missed your opportunity to enroll, or that you missed an opportunity to get additional benefits that might have been available to you out there.
Well, that's right, John. You know, for our senior community, you know, their health concerns and paying for their health is a big concern. And, you know, so, you know, Medicare is certainly one of those programs that every senior 65 and older that has worked in our economy gets the benefit of. And, you know, some seniors may even get some Medicaid assistance in addition to their Medicare if they are of particularly low income. So.
That's right. Well, if you have any more questions, you can always find us every Saturday at noon on our live call-in radio show. That's Aging Insight Radio on 107.1 live noon every Saturday. So feel free to call us and give us your questions there. And you can also catch us on the internet at aginginsight.com, or you can find past episodes of the show on KLFI TV. So take a look at either of those places if you ever have anything. Otherwise, we'll see you next week with a brand new episode.
Bye-bye.
Thank you for joining us for this week's Aging Insight program with John Ross and Lisa Scholmeyer. This program is made possible by